So thank you to all the Queenslanders who came out and got tested and also record numbers of vaccinations, which is fantastic. I do want to talk about vaccinations. We are calling on people to get vaccinated. However, we are running out of stock on Pfizer. So the Director General of Health wrote to the Lieutenant General John Fuhren yesterday and asked if we could get an extra 152,100 doses, so an extra 130 trays. The reason we gave is that we are at critical levels and that at some of our sites we are projected to run out of Pfizer by as soon as week 20. That's the 5th of July, next Monday. At some of our sites we are due to run out, and one of those sites being Sunshine Coast University Hospital. Our reason also is we said additional vaccine supply is critical to avoiding cancellations of already committed appointments and to ensure that we can continue to prioritise areas of high risk. Now, we sent that letter yesterday. We got a response this morning from the Lieutenant General. We have been advised that we will not be provided additional vaccines of Pfizer. Now, about 3 weeks ago, when Victoria went into lockdown and asked for additional supply, they got an extra 100,000 vaccines. We weren't offered less than what we asked for. We have been denied any extra vaccines. We are only getting about 64,500 a week in July, each week. We got 45,000 vaccines delivered yesterday. And on that delivery and our calculations, we have about 8 days stock. 8 days stock left for Pfizer. So we are getting to that point that we will have to start prioritising only second doses if the Commonwealth do not have any vaccine left. And they need to tell us, is what they gave Victoria the end of it? Have we only got what is allocated and no contingency stock left until that big delivery in October? Because we all need to know. Now, maybe this is why the Prime Minister's come out and suggested that under 40s get AZ. But we have to act on the TGA and ATAGI's advice in relation to that. It can't simply be because we have a lot of stock of one vaccine and not enough of the other to start recommending that people get a particular vaccine. That advice should always be based on clinical advice. So I am disappointed that we have been denied any extra vaccines, despite the reasons we've been given, despite the fact that we are going to start running out of vaccines. And I would welcome the Commonwealth telling us exactly how much vaccines they currently have on stock.